Okay, Allen's test. I'm going to ask the patient to bring that arm up and go ahead and pump it and then hold. I'm going to go ahead and grab both the radial and ulnar arteries. Open your hand, release, looking for it to refill, capillary refill. Go ahead and pump again and hold. Come up, bring it down, open, and release the other artery, looking for capillary refill. As long as the capillary refill is within 10 seconds, it's a good test, and it's not positive for any dysfunction at all, and it's a bilateral test. Okay, Adson's test. I'm going to ask the patient to go ahead and put their hand into mine. I'm going to get the radial pulse. Once I've got the radial pulse, I'm going to ask the patient to look to this shoulder, take a deep breath and hold. I'm going to have the patient hold for 10 seconds and then look up at the ceiling. Okay, go ahead and breathe. It's a bilateral test. Vital sign. You can kind of utilize the name to help. You're going to basically bring it in like riding a bike. There's several motions to it. So you're going to bring the arm, flex the elbow, adduct, and then extend. You're looking for any radicular neuropathy down the arm, and that's a bilateral test. Okay, I'm going to go ahead and get the radial pulse on both arms. Ask the patient to drop their chin to their chest, then force your shoulders back and down. I'm going to monitor the radial pulse, then I'm going to ask you to go neutral, and bring your chin to your chest. I'm going to force the shoulders back and down, monitoring the radial pulse, and then I'm going to bring it up the shoulders and trying to externally rotate, all monitoring the radial pulse. And that's a simultaneous test. Okay, with the patient standing, I'm going to ask them to go ahead and bring their arms straight out, and with their palms down, I'm going to ask them to pump their hands. Typically, the textbooks say 3 minutes. You're not going to have that time. You're just going to go ahead and say that it's a simultaneous test. Eden's test. Go ahead and find the radial pulse. Ask the patient to force their shoulder back, and then the doctor is going to exert downward pull, all noting the radial pulse amplitude, and it's a bilateral test. Halsted maneuver. We're going to have the patient in the seated position. Go ahead and take the radial pulse, and you're going to go ahead and exert some traction. Ask the patient to look away from the arm, and you're just going to try to recognize whether there's any dampening of the radial pulse, and the test is done bilaterally. Intermittent claudication test is very similar to EAST, except you're going to have the patient seated, arms extended, and palms facing upward, and ask the patient to go ahead and pump their hands just as you do in EAST. And this is a 1-minute test, and you're checking for any TOS, and that's a simultaneous test. Okay, pectoralis stretch test. You're going to have the patient place their hands, lock them behind their head, and then go ahead and ask the patient to squeeze their hands together, allow a little bit of time, and then ask them to go ahead and relax, taking control, and you're going to watch for basically symmetry between the drop, and it's a simultaneous test. Okay, tractioning test. I'm going to go ahead and get a good stance, get the radial pulse, just placing your arm on the shoulder, not to cut off any circulation or anything, and you're going to go ahead and traction the arm, and you're going to feel for any dampening of the radial pulse, and it's a bilateral test. You have the patient seated. You're going to ask the patient to give both hands. You're going to get the radial pulse, and you're going to basically bring the arms up to about 130, between 120 degrees, and you're going to feel for any dampening of the pulse, and it's a simultaneous test.